Welcome everybody to the Dr. Mike and Shannon Show. I am so excited today. We have an amazing author, urologist. She has great accolades from her. It's Dr. Martha Boone. I want to give you a little bit of background about Dr. Boone. And like I said, amazing accolades. One of the first 100 women who became board certified in urology. She's an academic urologist, been in private practice for over 24 years, top doc in urology in the Atlanta area for over a decade. Now, Atlanta is not a small town, so that is amazing. She's also a very successful author with 2 books and a third on the way. You can find her at www.marthaboone.com. And I want to welcome Martha Boone.
Yay.
Thank you for having me here today. I appreciate it.
Thank you. Oh, go right ahead, Dr. Mike.
Yeah, and I got to say, on top of all of her accomplishments, Dr. Boone, you are just stunning too. Just so you know, you are absolutely stunning.
Thank you.
There's just not enough good-looking doctors in the world. That's what I'm going to say, especially in our urology world. That we just don't have enough good-looking doctors in our world. So it's great to have somebody that not only has that presence of mind, but also has that. I would be happy to be one of your patients on the urology end and feel very
and in urology, it's even less.
That's right.
But enough about that. So what we are doing, so we always have a question of the day, and you have such an extensive background in urology. And I know one of the things that are near and dear to your heart is being able to discuss the topics such as UTIs. So I would love to hear, some points for people, some tips, what you can say, when should people worry? Dr. Mike, I know you have some questions as well.
I really do. So let me just give my spill. This is what I tell people. And we should also mention that Dr. Boone has a website. So as we get into the topics of conversation, she's going to be able to, you can access this website to be able to get all the information on, her book, and some of the things that she's going to talk about today. But we want to make sure we're mentioning that website, and correct me if I'm wrong, it's www.marthaboonemd.com. Is that correct?
Yeah, just marthaboone.com.
Marthaboone.com. Okay, marthaboone.com. And so, yeah. Dr. Boone, my question, this is what I tell my patients, is that when a lot of them are, when they're dealing with pelvic floor rehabilitation, a lot of them have chronic UTIs. Every month they're dealing with UTIs. Every month they're dealing with that problem. And I tell them that, what we'll do is we'll have them void, and then we'll do a bladder scan, and we'll see this urine. Sometimes it's over, a certain amount. And that tells me that they're not fully voiding. They got kind of, I call it a petri dish of urine that's kind of sitting there that I believe is what's causing these continual chronic UTIs. That even when we're hitting them with antibiotics, we're really not going after the source. But talk about UTIs with us a little bit. Talk about this thing that's so difficult for women and so painful for women. Tell us your take on what you do to deal with this really annoying problem.
Okay. So about 80% of women will have a urinary tract infection at some point in their life, and 1 in 4 will be plagued with repetitive infections. And the real question is, why doesn't every woman have this problem? Because the anatomy is a setup for the problem. The rectum, which is the largest content of bacteria in the body, is right next to the vagina, which is a warm, moist culture medium, which is right next to the bladder, which in many women either has a low bacteria count or is a sterile organ. So why we don't all have them is the interesting question. But the factors that probably lead to it are exactly what you said. Some people don't empty. And the studies show that if you have more than 100 cc's in your ultrasound that you were talking about, that puts you at increased risk. And I think the pelvic floor information that you offer is valid, because training people to relax and contract their pelvic floor and double void and empty could greatly help them decrease their incidence of urinary tract infections. The other factors are stress, and it can be good stress or bad stress. I can't tell you how many women are about to get married or go on their honeymoon or go on their dream vacation, and boom, they get a bladder infection. And we think the connection with that might be that they elevate their cortisol levels during times of stress, which can decrease their immunity. And so that could be part of it. Another factor is poor fluid intake. A person needs about half their body weight in ounces every 24 hours if they have no medical reason to limit water. And their urine should basically be pale yellow if they're hydrated. And so the mechanical motion of the fluid going through will wash some of the bacteria out. And then, other factors such as medical problems like obesity and diabetes, all of that can lead to problems that can cause a person to have bladder infections. As far as like what could actually help prevent them, the number one thing is to drink fluids. The number two is to double void, make sure that the bladder is empty. Number three is to consider taking a good quality cranberry supplement. For many years, I would hear patients come in and tell me crazy stories about cranberry helped them or cranberry didn't help them. And it's only been in the last few years that we've figured out what cranberry actually has to do with it. There's a compound called proanthocyanidins, we'll just say PACs, PACs for an abbreviation, that actually helps keep the bacteria from sticking to the bladder lining. And so if a person could get at least 35 milligrams of these PACs per 24-hour period, it can decrease their incidence of infections. And interestingly enough, the companies that have the largest marketing budget don't have the best products. So you can find on my website and in my book a little bit more detail about which products actually do work. And I have no financial relationship with any of the companies. But over a 30-year period, I figured out which ones work and which ones don't work. As far as drinking pure cranberry juice, if you drank a half a cup of pure cranberry juice every 12 hours, that would decrease your incidence of bladder infections by 50%. The problem is you would gain 10 to 15 pounds per year, and the pills and the cranberry juice cost about the same. So it's probably most cost effective and easiest for most women to just take a good cranberry supplement.
Oh, that is very, because I've always heard the cranberry juice and that being a magic pill. And it's funny you say that because I actually have a puppy dog who gets UTIs frequently because of her anatomy and put her on cranberry pills. It's like, maybe I should be doing this for myself.
Well, clearly,
so to make sure everyone understands, it's great for prevention, but it's not a treatment. Right. So if you have an infection, the cranberry won't get rid of it, but it's to help prevent the number that you have in a year.
Yeah, that's fascinating because I've seen things such as like Quorum and other products that now, they're talking that have commercials out on. So I will definitely be checking out, and I'm sure many of our viewers will be checking it out on your website, which ones actually, are recommended.
Yeah, it's a great thing to be able to have access to knowing. Number one, I had no idea that there would be that much weight gain. So right off the bat, every woman that I know would be like, no, there's no way I'm going to take this cranberry. There's no way I'm going to do that. The pill, yeah, that sounds great. Let's sign me up for that. The other thing that I thought was very interesting is what you talked about with the fluid intake. So a lot of the patients that we see that have urinary issues and incontinence issues and those kind of things will lower their fluid intake on purpose because they're trying to deal with this other secondary issue of incontinence that they could be having, whether it be stress incontinence or whatever the case may be. And that can only add to the problem of chronic UTIs because they're not getting enough fluid. I'm here in Vegas and we're in a desert, and like 90% of the people out here are dehydrated anyway. We don't get enough fluids, but I know for that population, it's quite a deal. So that's very eye-opening that could be a direct, not a cause, because it sounds like there's other things going on, but a very difficult symptom of trying to deal with the UTIs, but not getting enough fluid intake. So what would you recommend would be the right amount? I've had this question asked too. What's the right amount of fluids to drink in a day to keep yourself? Is it really looking at that urine and saying that's what's going to tell me if I'm doing it right or not, if I need to add more, if I need to add less, What's the rule?
If you have no medical problems and you're not taking, vitamins or medicines that can color your urine, then looking into the toilet and seeing that it's pale yellow should be a pretty good indicator. But the problem we really have right now is with people over drinking fluids. I can't tell you how many 5 feet tall women would come in my office drinking 2 gallons of water a day, wanting to know why they were incontinent. And it can also lead, over drinking fluids can also lead to poor bladder emptying, because the bladder is made out of smooth muscle. And if we expose too much volume to it over too short a period of time, the muscles will dilate and the bladder can't empty well. So the sweet spot for most people, unless they have medical advice that tells them otherwise, is about half of their body weight in ounces. So if you weighed 140 pounds, then you would divide that by 2, that would be 70. And that would be your average fluid intake in ounces, total fluid intake over a 24-hour period. And if you weren't running marathons or living in the desert or, any extenuating circumstances, that would probably be an okay amount of fluid for you. But, obviously you got to talk to your doctor and take other things into consideration.
Right. Oh, I love
Now,
that.
the big question is, so I'm a big coffee and tea drinker. When you are talking fluids, are you talking water only, or do all fluids count? Because I know that's important to people too.
So any fluid with caffeine or alcohol in it, you're going to urinate more than what you took in. And so if that's your primary fluid intake, you're going to get dehydrated over time. So you can have coffee and tea and alcohol, but you have to chase it with water, because you have to recognize that if you drink a cup of coffee that's caffeinated, you're going to urinate out a little bit more than that. And over time, you'll get kind of dehydrated. So no, all fluids are not created equal. And you want to avoid real sugary fluids, because that's delivered to the bladder and the bacteria love that. That's like party time for the bacteria when you have sugar in your urine. But the real problem with this is that the doctors have been poor stewards of antibiotic use. We have prescribed antibiotics too much, and we have prescribed too strong of antibiotics. And the bacteria are brilliant. They will mutate and change over into something else when they recognize an antibiotic has been given to the system. So it behooves both the doctors and the patients to try to decrease the incidence of these superbugs, because what happens is if a woman ends up taking antibiotics more than 3 or 4 times per year, then the next thing you know, they have to have intravenous antibiotics. Then the next thing you know, they have to get hospitalized. Then the next thing you know, there's not an antibiotic that will treat their problem. So it behooves all of us to try to work on the prevention end. And one thing that's underutilized is in the perimenopausal or postmenopausal woman, using intravaginal estrogen. That changes the pH of the area, builds up the urethra, and can help with both incontinence and urinary tract infections. So if a woman's having more than a couple of them per year and she's postmenopausal, she wants to definitely consider talking to her doctor about possibly using intravaginal estrogen.
Oh, that is actually not something I've heard before. So that's very, very interesting. I'm taking notes. I have another question for you. Double voiding. I know a lot of people aren't going to understand what that means. Can you explain what that means?
Well, this is part of the power of going to a pelvic floor physical therapist. Neither your primary care doctor, nor your urologist, nor your gynecologist has the time to spend to really train you how to double void. Now, there may be some websites on the internet that have some information about it, but if you have any trouble figuring out how to do it, a few visits to a good pelvic floor physical therapist will take care of this, because they'll be able to actually show you where the sphincter muscle is and demonstrate how to relax. Because what you don't want to do is use your abdominal muscles to strain down and push your bladder out and then give yourself prolapse. So it's not complicated, but it can be a little bit interesting for people to figure out exactly how to do it. So I can't emphasize enough the power of pelvic floor physical therapy if you're having any trouble figuring that out.
Yeah, because I didn't want people to think, okay, they've gone. Now you need to like clamp down and stress and try to get it out, because then you're causing a whole nother issue.
Yeah, you could make it worse.
Yeah. So, yeah, extremely fascinating. Dr. Mike, any questions? We actually have this as a 2-part series, because we're going to do.
I could be talking. I could talk to you, Dr. Boone, for hours about this. To be perfectly honest with you, I mean, everything that you said is dead on with what we're trying to do with with the pelvic floor rehabilitation, and understanding the neurological versus the biological aspect of the usefulness of the pelvic floor, and not utilizing those stomach muscles. We use EMG to confirm that our patients aren't using those muscles when they void, and when they contract the muscle, and when they do the bulba cavernosa, reflex exercises that we're having them do. So it's dead on with what I absolutely agree with everything that you're saying. And, I think that this book is just going to be an eye opener for a lot of women that I think suffer in silence more than they should, or that they just feel like when they're with their doctor, they don't have enough time with their doctor to really get these things out. Because I've heard too many women say, well, I'm getting older, so this is why it's this way. And, it's been this way for 10 years. There's no new fixes for that. And that's absolutely not the case. And I think that your book is a great way for people to start getting an understanding of what we as physicians start to, try to do. And like you said, sometimes we're not as good as stewards about information that would be useful to help our patients, especially when they don't tell us what's going on. So I highly encourage people to get onto your website, to buy your amazing book, and to get some good information about what you've shared with us today, and even more so. And in part 2, it'll even be better. So.
And everybody
Thank you.
stay tuned for part 2, because that will be coming out next.
That's right.
Thank you.
So we'll close it out today. Shannon, close us out today, and then we'll go on from there.
And thank you, everybody, for joining us on the Dr. Mike and Shannon Show. Especially thank you, Dr. Martha Boone, for taking your time out and explaining what, the causes of UTIs are. And we can't wait to come back and talk to you about the 3 books that you have. Thank you very much. Have a great day.
See you guys soon.
Thank you.